We're moving on to our final issue. Thank you, panelists. This is the California Department of Aging Program and Budget Review. We want to call forward our panelists, Laura Connolly, Clay Kemp, Karen Jones. We have a number of representatives from the LEO's office and finance. And we're also anticipating to hear from Assemblymember Brown, if Assemblymember Brown is present. Okay, let us begin. Ms. Connolly?
Yes, I just wanted to make sure that you received the handout from the department.
Thank you.
Is it coming?
Whenever you are ready, we
Great.
are.
Thank you. Thank you very much for the opportunity to be with you this afternoon and provide an overview on the Department of Aging. I'm going to actually follow along track with the handout that we provided to give an overview, a brief overview of the department. And let me just begin with that. And I have with me Ed Long, who was previously up on the panel as well. The Department of Aging's mission is to promote the independence and well-being of older adults, adults with disabilities, and families through access to information and services to improve the quality of their lives, provide opportunities for community involvement, to support family members who are providing care, and to collaborate with other state and local agencies as well. The Department of Aging is the federally designated state unit on aging, and in that capacity, we administer funds allocated through the Federal Older Americans Act and the Older Californians Act, and as well through the Medi-Cal program, which you heard about a little bit earlier in the hearing today. The department contracts with a statewide network of 33 area agencies on aging, also referred to as AAAs, who directly manage a wide variety of federal and state-funded services. And I'm just going to move on to page 2 of that handout that goes into a little bit more depth about what those programs are. I think usually when I talk about the department, the first program that comes to people's minds are the nutrition programs, and they certainly are our largest ones. So senior nutrition is one of the major Older Americans Act programs, providing both meals in congregate nutrition centers as well as home-delivered meals to individuals who are age 60 and over, and those who are homebound due to illness, disability, or isolation and inability to come into a congregate setting. In the prior year, 17 million meals were served throughout California through this particular program. The other major service that people frequently recognize is the supportive services under the Older Americans Act, which provides assistance to older individuals and families to help them live independently as possible and to access services that are available to them. Those services include information assistance, one of the very frequently used programs, transportation services. In some areas of the state, the area agencies may be providing some funding to senior centers for specific programs, in-home and case management services, and legal services for frail older adults as well. And in the prior year, 800,000 clients were served under the supportive services funding program. Senior Legal Services is actually a program that doesn't get as much visibility when we talk about the Older Americans Act, but it's one of the supportive services also funded under Title IIIB, and it is a priority service, which means that each area agency on aging must include this legal services program as one of their funded services. There are currently 39 legal service projects that assess the legal service needs of older adults and adults with disabilities in their community and help respond to those consumers' legal issues. And The most recent program added to the Older Americans Act is the Family Caregiver Support Program, and that provides support to unpaid family caregivers of older adults as well as grandparents or other older relatives who are raising their grandchildren. You've already heard a little bit about the Long-Term Care Ombudsman Program, but that is also funded under the Older Americans Act. Ombudsman and elder abuse prevention are a key program there in terms of investigating and resolving community complaints made on or behalf of individuals who are residing in long-term care facilities. Another, I think, very well-known program that's offered throughout California through the Area Agencies on Aging is the Health Insurance Counseling and Advocacy Program known as HICAP. This program provides personalized counseling, education, and outreach through community events to Medicare beneficiaries about their health and long-term care options as well. In the prior year, 99,000. We couldn't make it to the 1 million mark last year. Couldn't round up on that one. 99,000 individuals received services through that program. And then through Department of Labor, we also have a program for senior community employment, which provides part-time subsidized work-based training and employment in community service agencies for low-income individuals who are age 55 and over and have limited employment prospects, need some retraining to boost those skills so that they can re-enter the workforce in an unsubsidized situation. We spoke early in the prior panels in terms of our Medi-Cal programs that we administer through an interagency agreement with Department of Health Services, the MSSP program, as well as the CBAS program in terms of the oversight for that program. In terms of the department's budget, and I'm on page 4 now of our handout, the governor's proposed budget for fiscal year 15-16 for CDA is $196 million. $32.3 million of that is general fund. And as you can see from the chart below on page 4, the majority of our funding at this point is from federal funds, with the general fund to support the match requirements for those programs. And we were asked to give a little bit more history in terms of, the reductions over time historically that these programs have taken, particularly the Older Californians Act programs. So they are included here in the budget as well. The one other thing that I would just like to mention in terms of where we are currently is certainly given difficult times over the last number of years in terms of the state budget, we have been very persuasive and successful in going after any federal demonstration grant fundings that were available to the department to be able to continue to be innovative and bring new resources to the state. And we have 3 of those that I think are mentioned on page 7. The Chronic Disease Self-Management Program, which is a 6-week workshop to help adults with chronic disabilities better manage their own health, because as we know, 99% of our time we're our own healthcare providers and managing our own health needs. So this is a program that is a 3-year grant that we've been operating in partnership with Department of Public Health, both at the state level and local level, and trying to make this program more available to individuals, particularly in underserved communities in the state. And we are currently offering it in 11 languages, which I think certainly speaks to the diversity of our state. We also, in coordination and to support the efforts of the Coordinated Care Initiative, secured an Administration on Community Living grant to help train the care managers that are operating in the CCI counties in those health plans to help them better understand and be able to respond to the needs of beneficiaries who will be entering their plan who have Alzheimer's disease or some other type of dementia. So this training that we're doing in partnership with the Alzheimer's Association chapters directly provides training to the care managers, the plan's care managers, and then works with those plans to create a dementia specialist within the plan who really works throughout the organization to improve the service delivery and the plan's ability to meet the needs of those individuals who are most often at high risk of future institutionalization. And then we also have a federal demonstration grant from the Administration for Community Living to enhance the legal services program that I mentioned earlier. It's a model program working with the legal services providers, the area agencies on aging, to continue to refine how best to provide those services given the limited federal funding available for legal services. And I guess last but not least, we also have a CCI grant to increase the resources available to the HICAP program to provide one-on-one counseling and outreach in the CCI counties to individuals who are getting those notices and trying to better understand what their options are in terms of CalMedi Connect and the Coordinated Care Initiative. So I think I will pause at that and ask if you have questions or I can talk anything further.
Thank you, Director Connolly. We will have some questions for you later. I'd like you to stay nearby, and but we will ask if Clay Kempf is ready to present. Thank you.
Sure. Clay Kemp, and I'm Executive Director of the Area Agency on Aging of Santa Cruz and San Benito counties, and I'm representing California Association of Area Agencies on Aging. We're the community-based organizations that partner with the department for the delivery of these services. We're looking at the growth in the aging population and recognize, as I'm sure you do, that the population is literally exploding. We have 1,000 seniors turning 65 a day. And that might not be a concern if we weren't saying that seniors were consuming the bulk of healthcare costs in our state. Our local managed care organization reports that 8% of the population is incurring or using 75% of the expenses. So we feel that we have a role to play in controlling that crisis, if you will. And we also realize we can't stop people from turning old, nor is it necessarily a bad thing that they do. So our approach is to see if we can create a healthier community, a healthier aging community, in order to control some of those costs before they become runaway expenses and concerns and a true crisis. So our proposal focuses on that, and in our discussion we came up with 4 key areas that we thought go the farthest towards achieving that goal. The first one is access to and coordination of care. Obviously, if somebody doesn't know about services, they can't receive them. And even though things like information and assistance, which provides that access, is not seen as the sexy program or the cute program, it's nevertheless critical. You can't get services if you don't know they're out there. So we really think information and assistance is the key entry into the service area. Coordinating the quality of that service is another place where we also see that a lot of economies of scale and benefits can occur. The second category is proper nutrition. I think that's a rather obvious one, and I won't waste anybody's time repeating about that. But obviously, if a frail senior doesn't eat properly, we know their health's going to deteriorate. Our third category is caregiver support. Most of the care in this community, this state, this nation is provided by family members. And if we want to make sure that continues, there needs to be support pieces in place. And just one example of why we think this is a valid proposal that should be considered. Within that category are Alzheimer's daycare resource centers. The cost of running a daycare resource center is $80,000 to $85,000 per year. Between 25 and 75% of the people that attend those resource centers are literally not able to live at home without a daycare place. Family members either have to quit work, kids miss school in order to take care of grandma and grandpa, or the person ends up in a long-term care facility. The cost of a long-term care facility, ironically, is somewhere between $55,000 and $85,000 per year. So if even just one person in each one of those centers per year does not end up in a long-term care or a skilled facility, we're breaking even on it. And it's far above that. 10% would be a $50 million savings to the state, and so on as the number goes up. So it's kind of the approach we took to this whole proposal, is that let's look at programs that have a meaningful financial impact to the state that benefits controlling costs in the future, and that improves the quality of life of both the seniors and their family members. We know that it's more effective to keep people healthy than it is to build more health centers to treat them. And that's our goal. That's what's in the proposal. You have a couple other proposals before you. Assemblywoman Brown's proposal is similar to ours in many ways. We're really thankful that that's being considered and look forward to additional dialogue on this. And we also, within ours, I did not get to mention the elder abuse piece, which echoes what, among other things, it echoes what the Ombudsman is proposing. So I won't touch that piece since we have a speaker to do so.
Okay.
Thank you, Ms. Kemp. I'm sure that Ms. Jones would be happy to touch on that, and we welcome you. Thank you for your public comment, and thank you for your presentation. You may begin.
So my name is Karen Jones. I'm with the Long-Term Care Ombudsman Program in San Luis Obispo County, and as I mentioned earlier, I'm also on the board of the California Long-Term Care Ombudsman Association. And I wanted to give a brief history of the program. It was started in 1978 by federal law and then quickly followed by state law to provide services to people who live in care facilities to promote the highest possible quality of life and care. We're there to make sure that the people who live in a care facility are treated as individual human beings and not just numbers and dollar signs. Because truly, healthcare in America, we tend to be dollar signs, and that can be very tough on folks in care facilities. In California, the program is made up of 35 local programs and a state ombudsman office. The local offices include 108 paid staff and 856 volunteers. The services we provide are particularly advocacy. We do complaint investigation and resolution. We do unannounced facility visits to monitor the condition of the residents, elder abuse investigations, witnessing advanced health care directives, and providing information and assistance on long-term care issues. In 2012-13, ombudsmen around the state investigated approximately 40,000 complaints made on behalf of the care facility residents. We also resolved those complaints. We provided approximately 3,000 care facility visits in more than 8,800 care facilities around the state. We did all that with less than $3 million in federal and state funding. There's often confusion about the role of the program in relation to the licensing agencies. We are the only agency that is there for the people who live in the facilities. Our job is to make sure they are treated as human beings. The other agencies are there to make sure that the care facilities are compliant with licensing regulations. It's a slight but very important difference. Both agencies work to protect the residents, but our goals and our methods are slightly different. As a quick example, last week my office was asked to help a family member whose loved one had dementia and had been in a care facility for about 6 months. The facility staff were not happy because he had developed some difficult behaviors, which are very typical of people who have dementia. They were needing to do one-on-one staffing with the person to make sure he wasn't a danger to others. We met with my office staff, myself and a volunteer, met with the family, and then we also met with the facility staff to resolve the 10-plus complaints about care issues that were going on, how the staff were treating the resident. There had also been a verbal eviction notice given, which is not legal, and they were very close to issuing a written eviction notice. Because of our involvement, we were able to prevent any further eviction efforts and to resolve the complaint issues that were related to care. That involvement meant that he wasn't evicted. He didn't have to move out of the area, which was where they were planning to send him was to some county far away from San Luis Obispo County. But in addition, as a side benefit of the program, we really do save the state a significant amount of money. If this had gone on to an eviction notice, licensing agency would have had to come out. It would have been a 6-hour round-trip for the licensing agency to come from their office in Oxnard-Ventura area to the northern reaches of San Luis Obispo County. So there would have been likely an overnight stay for them, in addition to all of the hours spent investigating the complaint. And for the family members, the benefit is that it was resolved that day, immediately, and they didn't have a long delay. As we know, licensing currently is forced to endure themselves. And the cost to our program was about 2 hours of my time, 2 hours of a volunteer time, and a little bit of mileage reimbursement. So it was a significant cost savings to the state of California. More importantly, the resident didn't, as I mentioned, have to leave the county. We know it's a lot of evidence that the people who are most likely to be abused in a care facility are those with dementia and those who do not have frequent visitors. Had he moved out of the area, he would have been subjected to all of the factors that would have made him most likely to be abused or neglected. And I want to point out that unfortunately not every care facility resident has this type of access to the Ombudsman program. We have been really fortunate as ombudsmen that our failings and our inability at times to do our job has not hit the media as the licensing agencies have over the past couple of years. But if our detractors were here today, they would tell you that we are not doing our job. We are failing in so many areas, and it's all about the resources. We do not get a lot of money from the state. We don't get a lot from the federal government. We do our very best to make our job work. But there is a point at which you do have to throw money at the problem, and the problem is underfunding. I totally understand the state budget issues, and the recession was hard on so many agencies. But this program could, within just months, be up and running to a much better degree and be providing services that would alleviate burdens on other state agencies, particularly licensing. And we would urge you to please consider the entire proposal for ombudsman funding, which is $4.2 million, and in the future even some increases, because that'll get us back to adequate funding, and we will be able to do our jobs so much better, and we will make such a difference for the state of California. The results would be nearly immediate. Thank you.
Thank you, Ms. Jones. Ms. Kesarwani, anything from the LAO's office?
We have no comments.
Thank you. Anything from finance? Thank you. It's an honor for me to ask my seatmate, my colleague, to join us here to provide us a few remarks. She needs no introduction, but I will tell you about Assemblymember Brown. She is chairing the Assembly's Aging and Long-Term Care Committee, and she regularly tells us about what she calls the silver tsunami that we heard about today, the 1,000 people who turn 65 every day, and the needs for care and how important it is. She's also, in my mind, the chair of what I call the on-time caucus. And when you're a freshman assembly member and you need to know how important it is to be on time and start meetings on time, and she showed up to this meeting 2 panels ahead of hers because she's always on time. It's an honor to welcome her to our committee, Assemblymember Brown.
Thank you, Mr. Thurman. It is a joy to be here today to address you, and I'm so proud that you're my seatmate and that you're sitting there handling this budget committee. I want to take a moment to acknowledge your amazing work and this important undertaking. I wrote a letter to you and the members of this committee to promote programs and services that support dignified lives for older Californians, integrate the older population into our larger community, protect families from the devastating financial toll of long-term care, and assure that caregivers and their needs are equally recognized. And without them, our entire system, indeed our entire economy, could face disastrous consequences. That's where the silver tsunami hits. We would not be here today without the contributions that the older populations made when they were younger. We're standing on their shoulders, and all we have it because the struggle and sacrifices that they made. Thank you for receiving my letter of January 14th, which spells out a range of funding priorities that will begin to restore hope for older adults in California and those who care for them. As you've heard me say many times, and you'll hear me say for the next 10 years, that 10,000 Americans are turning 65 every single day, and that'll continue for the next 17 years. Fully 20% of our population will be 65 by 2030. Over the last 10 years, state funding for senior programs within the Olders California Act for olders and disabled adults has been systematically dismantled due to unfavorable economic conditions. Since 2004, over $30 million in Older California Act services have been cut, resulting in the elimination or dramatic reduction of critical community-based programs and services provided through the state's area agencies and aging and counties. Community-based programs through the Older Californians Act enable seniors to remain independent and in their own homes, avoiding costly placement in institutional settings. The drastic cuts of 10 years have done serious harm, devastating the ability of area agencies on aging to fulfill projected growth over the next 3 decades, not to mention the growing prominence of Alzheimer's disease. We must make essential state investments to repair and revitalize the network of flexible, person-focused, and caregiver-focused services. The proposals contained within my letter only represent those programs and services that are in the older Californians Act. If it's not there, it should be. The Coordinated Care Initiative is separate. It requires its own attention and due diligence to assure care is adequate. Now, as I understand, it was supposed to save the state $500 million. And I understand it hasn't worked. And now it's slated to cost us $35 million. So I heard that was reported today by DOF. And you know, when DOF reports something, it is the gospel. Mr. Chairman, I want to thank you for this unprecedented opportunity to come before you and advocate for a rapidly growing portion of our population that has been overlooked and underappreciated for too long. And remember, if you're 50 today, you'll be turning 65 soon. Thank you so much. I appreciate that.
Thank you, Assemblymember Brown, for your leadership and for your letter to the committee, and for your impassioned advocacy for older Californians and older Americans. Everything you say is the right thing to do, and thank you for articulating it and for embodying it as our leader here in the Assembly. We're not agendized for any action on your proposal today, but we would like to have ongoing conversation between this subcommittee and certainly with your policy committee on those topics. And you are always welcome here to come and discuss that topic or any other one here in this subcommittee.
Thank you so much.
Thank you.
I really appreciate your leadership.
Thank you. Is there anything else that you want the committee to know today?
I can't think of anything other than we need the money. You know, we've asked for the Ombudsman program money. We've asked for the resource centers monies. We've asked in our letter for what we think would just bring us kind of even. It's not going to give us anything, but it's going to at least we'll be able to do a little bit better by our seniors, and it's so important because.
I would agree with you and say you're right to break it down to just show us the money, right? We need the money. I would take it one step further to say that it actually would give us something, a great return on investment. And I absolutely agree with everything that's been said here today. You know, I had the privilege of starting my career as a social worker. I am still a social worker, right. And I've worked with children, and I've also had a chance to work with older Americans in their home, seniors who are hungry, seniors who are homebound, and it certainly was very, very. It was influential for me to experience it personally, and I say that to say that I'm certainly sensitive to the issues that we discuss, and looking forward to the ongoing conversation with you and your policy committee.
I'll be sitting there, chewing off your ear every time we meet in session.
I know you will. I look forward to it. Thank you, Assemblymember Brown.
Thank you.
Thank you. You know, I don't have any other specific comments or questions other than to thank you for the presentation, for the great work, and I understand how stretched you all are and what you're doing with the resources that you have. Are there any other critical issues that you want the committee to be recommending? We'll start with you, Madam Director.
Not at this time.
Thank you. Thank you. I said what I needed to say.
Thank you.
I think I would just echo the Assemblywoman's comment that the augmentation kind of gets us back to even. It's not putting us really moving the issue forward, and it's a huge topic we'll be facing for a while.
Thank you.